My name is Tina Townsend. I am actually a health and safety consultant that started out in the Braintree district about 15 years ago. So my company name is Acacia Business Services, and as I say, I'll be taking you through a health and safety awareness program today. So we need to look at how we can implement health and safety measures. They don't have to be stupidly expensive. They certainly don't have to be time-consuming or complicated. In fact, the most efficient practices will often save the most money and, importantly, save from injury. Now, the Health and Safety at Work Act clearly states that it is the employee and the employer's responsibility. So it's straight from the regulation, says that an employer has to provide a working environment that is safe and without risk to health. Other things you'll need to think about is maintaining safe plant. Now, any piece of equipment, even the computer that I'm currently sitting in front of you doing this webinar from, has to have had some pat testing done on the cabling to make sure that it's safe to use. I will have to also potentially look at a safe operating or safe system of work. Now, we have duties, again, as employers, to maintain safe handling, transport and storage of everything from plant to substances. So if you are storing any chemicals, for example, you need to make sure that you're storing them in the correct manner. If they're flammable, they would need to be in a flammable safe cupboard. If they are likely to spill, that would need to be bundled. You also need to think about some drinking water. Now, it may be again that is portable. It doesn't necessarily have to be that it is running straight from the mains, but you should provide something. There should also be some way of washing your hands and being able to clean yourself up. Now, being an employer is one thing, but you also have to be an employee at some point. And you will have those employees who will say, well, you know, the boss looks after health and safety, it's not down to me. Unfortunately, that's not the case, and there is a section, which is section 7 and 8 of the Health and Safety at Work Act, where it actually is very specific and it is very clear, and it states that it will be the duty of every employee to take a reasonable care for themselves and for others who may be affected by their acts or omissions. Now, with health and safety law, whether you are an employer or whether you are an employee, you are guilty from the moment an incident happens until you have proven that you have done everything that is reasonably practicable to actually have prevented that from happening. If you are an employer who has 5 or more staff, whether they are part-time, full-time, volunteers, but 5 or more, you have to have a clear health and safety policy that sets out your intention and how you are going to manage your health and safety in your workplace. So one of the things that you will need to do is manage risk, and risk assessments are the only real way that you can do this. Now, to complete a risk assessment, you are looking at all the things that are likely to give rise to harm. You are then looking at how you will control them. You are looking at how they affect different people, so different people in your business. You may have people who have disabilities, they will need to be considered. You may have those who are just in a certain skill set that may need to be considered. You should have an asbestos survey carried out. Now, that asbestos survey will look at someone will come in, they will take samples of areas where they believe it to be, and this is where you would use specialist contractors. They will take a look, they will send off samples, they will identify whether it is or it isn't, they will identify the type of asbestos it is, whether it is a risk or not to you. You will then have a register, and on your areas where the asbestos is present, there will be small stickers. So it's important to remember that working at heights can happen just with any environment that you're working in. You could be just trying to change a light bulb. And the things you should also always remember to do is to climb on things that are stable. Don't go on unstable surfaces. The amount of times I will walk into offices and catch people trying to get something off the top shelf on a wheelie chair. No. Now, you have a legal responsibility to provide first aid trained staff. Those trained staff are offering a basic casualty assistance until medical help is required. They are not expected to do anything like carry out any invasive procedure, offer any medication. Can I make you aware that You are not even allowed to hold in your first aid boxes things like headache tablets, Savlon cream, for example, or any other antiseptic cream. You can only hold sterile wipes. You can't hold anything that somebody would either ingest or put onto their skin. In many schools and other establishments, they will not even want you to put a plaster on.